Hi, this is Attorney Bob Lightfoot from Reinhardt Berner Van Duren coming to you again from beautiful Verona, Wisconsin. Just finished getting off the DHS weekly COVID-19 call, and that call lasted about an hour, and I have some additional information for you. The first part of the DHS webinar was simply informational. The second half was kind of a Q&A. So let's go over and summarize some of that information for you. First of all, we're up to 707 positive cases in Wisconsin. And for information, again, I direct you to dhs.wisconsin.gov. And the COVID-19 website within the DHS website has a lot of valuable information. It's constantly being updated. In terms of testing, the state has now developed testing tiers by priority. It is a little bit in conflict with the CDC testing tiers. For instance, in Wisconsin, Tier 1 does include long-term care residents with unexplained fever or signs and symptoms of acute respiratory illness. In the CDC, that's a Tier 2, or Level 2 as they call it. So there's a little bit of discrepancy with regard to testing. There are, in addition, some new resources available on the CDC website, including how to deal with PPE shortages and calculating what they're calling a burn rate, which I interpret to be a usage rate. There's also today at 1 o'clock, today's Friday, March 27th, and there is a call at 1 p.m. Central called the COCA call. These are the clinician calls. I've been sitting in on those as well, and I will today, and hopefully provide another video update for you. DHS has also created a health alert network. If you go on the DHS website, you can sign up for that. Some of the information that's been put out just recently is that the testing capacity for COVID-19 has increased from 2 labs now up to 40 labs, and capacity has increased from about 500 tests a day to about 2,000 tests per day. One thing, DHS and CDC protocol are still recommending against testing asymptomatic persons. So please be aware that you're not going to get a test unless you are symptomatic. But you should be aware that a clinician can order a test on whomever they want for whatever reason. So even an asymptomatic person could be tested if it's through a clinician order. Next is telehealth has been greatly expanded on the coverage, especially on what they talked about, the Medicaid side of things. So Medicaid telehealth services have been expanded both permanently and with regard to this safer at home time frame established by Governor Evers. So again, if you want information on that, go to Forward Health, that's FORWARD HEALTH, forwardhealth.wi.gov for more information on the expansion of telehealth services. The sites have been expanded, so now a telehealth site can include the home, and that will be covered, and e-visits will be covered, so that's good news. Next, they talked about the 1135 waivers for nursing homes and other Medicare recipients. There have been some automatic 1135 waivers that in blanket fashion that have been granted. This would be Medicare certified. Now, if you are a nursing home or another Medicare certified entity, you can always apply for additional individual waivers, but there is a whole set of blanket waivers that have been granted that you do not have to apply for and that you can implement immediately. In addition, all non-essential surveys have been suspended. I talked about that earlier. The only surveys now taking place are surveys involving serious concerns and anything involving new licensing, like new hospitals, new assisted living, new nursing homes, new spaces. So those are the types of surveys being conducted. Blanket waivers are coming for assisted living. They did say that in conjunction with Leading Age and WALA and WHCA. I did work with Leading Age and WALA on coming up with some blanket assisted living waivers, and we did submit those 2 days ago to DQA, and those are being considered, and those will be coming out. Otis Woods, the DQA Bureau Chief or DQA Chief at DHS, did say that individual facilities still may request individual waivers, and they would try and get to those as promptly as possible, but that there will be blanket waivers coming out. In addition, there will be facility type specific webinars being put out next week by DQA. So there will be assisted living webinars, there will be nursing home webinars, and they're specifically splitting those because of the different program requirements. And then he believes there will be webinars as well to address hospice, personal care, in-home care, and home health. So look for those for next week. That's it for the background information they talked about. I just summarized 30 minutes of information for you in about 5 minutes. So here's the Q&A section now. There was a question about the use of Advil and ibuprofen. As you know, I just saw something on Facebook yesterday about people giving this dire warning about anyone who's COVID-19 positive using ibuprofen or Advil. The state epidemiologist said they are studying this. They're continuing to study this. Right now, he said there is no reason to associate ibuprofen or Advil with worse outcomes, but he says it is unknown. So as a precaution, if you are treating in your facility someone with COVID-19 symptoms that's positive, you may want to switch to something like Tylenol, acetaminophen, and avoid the Advil, ibuprofen, just because it is unknown right now. The next question talked about transmissibility, and the state epidemiologist did say that they have learned that someone is highly transmissible even with simply mild symptoms of COVID-19, so be aware of that. The next question talked about whether or not PPE should include a hair covering, and the CDC has not come out with guidance on this, but there was a recommendation on the call today that if there was an aerosol generating procedure, that certainly you could use it, and just use your discretion on that. The next was a question about homemade masks, and again, CDC has not come out with any definitive statements, but has said that if there's nothing else available, you certainly can use a homemade mask, but that will not provide the same protection, obviously, as an N95 mask, so kind of use at your own precaution there. Next was a discussion about discharging COVID-19 residents from the hospital, especially into nursing homes or assisted living, and what was the guidance on that. Otis Woods said that admissions are not prohibited in Wisconsin to assisted living or nursing homes from hospitals, or even from home, for that matter, into your facilities. But if you are accepting someone who was known to be COVID positive, you may want to take extra precautions, such as putting that resident in quarantine temporarily. But again, there's no ban. Treating all admissions coming from the hospital as though they were COVID-19 positive would be a best practice, but not required at this point. They are working on additional solutions to that problem. If you do have multiple locations, and you are staffing with multiple locations, the recommendation is to minimize that as much as possible because of the potential transmission. They realize that staffing is scarce, and they did not, in this call, prohibit staff movement between facilities, but highly recommended against it. Next, there was a question about healthcare screening and signs and symptoms of that. There are no specific requirements for how often or what type of screening. They said that they would hopefully be able to share some best practices in the future, but there is nothing right now. But again, to bear in mind that even a minimally symptomatic healthcare worker can transmit if COVID positive, so be aware of that. And in terms, again, of a PPE question that came up, there is conservation strategies on the CDC website that you should be aware of if you are running low on PPE. In terms of healthcare workers and their clothing and coming home wearing their clothing, there was no specific guidance from the group today on that. Some folks are leaving their work clothes at work, and that is certainly something that could be done, but there's no evidence at this point to give guidance either way. They did recommend on limiting such extra clothing and accessory items such as scarves and jewelry, that obviously those would be potential sources of transmitting disease. So try to limit the use of that. Adult daycare was another question that came up. They are coming up with and finalizing guidance that will come out on the DHS website very soon on that, but at this point, no guidance as yet. So we'll keep looking for that and provide you with a resource at our reinhardtlaw.com Coronavirus Resource Center. We'll provide that for you. For facility-specific questions, they are advising at this point, and punted on this a little bit because I had a particular question on facility specific in terms of staff, and they are referring that to local public health at this point. So a little bit of a punt on that. If there is no high risk exposure by staff or anyone else, including residents, should be okay to work. But if there is a high-risk exposure, which I assume would mean an aerosol generating close contact with a COVID positive, then that staff or that person should go into quarantine, even visitor, I'm assuming. Then there was a question about what PPE should the person that's checking employees at the door be wearing. And the state epidemiologist said that some recommendations have been for the employee to self-check and self-screen at home and report. And some are checking, and many, I think, are checking at the door prior to the shift. Certainly a mask is okay at the door, and obviously people should not be coming to work if they have symptoms. The final question involved bringing food and flowers from a family member into the facility, and obviously we should be restricting very heavily and very highly any and all visitors coming in, but they stopped short of dissuading that and just saying it's on a case-by-case basis for that. So that's my update for today. I will probably do a CDC COCA clinician webinar for you as well, but wanted to give you the highlights and everything from this morning's DHS weekly update call. As always, if you have questions, feel free to call me. Feel free to follow me at Bob Lightfoot on Twitter. Follow me on LinkedIn. I'm providing constant updates there, and be sure to go to our Reinhardt Resource Center at reinhardtlaw.com. Thank you. Talk to you soon. Bye.